Few things destroy a man's ego more than starting sexual intercourse with everything working well and suddenly, in the middle of the act, completely losing rigidity. It is an embarrassing situation that generates an immediate apology and plants a seed of devastating insecurity for future attempts. Unlike not being able to get an initial erection, losing it in the middle suggests that the problem might not just be a lack of libido, but rather a leak in the system or a sudden mental block that needs to be identified with precision. In this video, I will reveal the 4 real causes that make your engine shut off in full motion, separating what is myth from what is biological. You will understand why this happens, how to identify your specific case, and what to do to ensure the erection stays firm until the end. Pay special attention to the second cause, as it is a physical mechanical problem that many men try to treat with a psychologist when they actually need a urologist. The mechanics of erection. To understand why the erection goes away, think of your penis as a tire that needs to be inflated and keep the air inside. The arteries are the pumps that push blood into the corpora cavernosa, and the veins are the valves that close to prevent this blood from leaving. During a healthy erection, the blood inflow is massive and the outflow is totally blocked by the compression of the veins against the tunica albuginea, maintaining the maximum rigidity necessary for penetration. The loss of erection during sex happens, invariably, due to an imbalance in this equation. Either enough blood stopped entering because stimulation ceased, or the blocking system failed and the blood leaked back into the body. Identifying where the failure is, whether it's in the intake pump or the outlet valve, is the secret to the correct treatment. Before we get into the first big cause, which is chemical, I need you to understand that your body cannot relax and be alert at the same time. If you want to deeply understand how your machine works and stop being embarrassed, click the like button down here and check if you are subscribed to the channel, as this helps YouTube deliver more vital content for men to you. Cause 1. The mental saboteur. The number 1 cause, especially in younger men, is the sudden discharge of adrenaline caused by performance anxiety. An erection depends on the parasympathetic nervous system, which is the relaxation system, whereas anxiety activates the sympathetic system, releasing adrenaline. Adrenaline is a potent vasoconstrictor, meaning it instantly turns off the tap of the arteries to divert blood to the leg and arm muscles, preparing you to fight or flee. The moment you have an intrusive thought like, "Will I be able to keep it?" or "It's softening," your brain triggers this chemical alarm. The penis obeys the survival order and empties to ensure there is blood available for vital organs, killing the erection in seconds. It is a primitive defense mechanism that plays against you in bed, creating a vicious cycle where the fear of failing causes the failure itself. And this leads us to a very specific mental behavior that worsens everything. The spectator cycle. Within anxiety, there is a phenomenon we call spectatoring or the spectator syndrome. Instead of being immersed in the physical sensations, the touch, and the pleasure of the moment, you step out of your body and become an inspector of your own erection, monitoring every second if it is hard enough. This hypervigilance disconnects your brain from the real erotic stimulus and focuses it on worry, cutting the electrical signal that keeps the arteries open. Sex requires surrender and positive distraction. When you rationalize the mechanical process, you inhibit the natural autonomic reflexes. It's like trying to control your heartbeat consciously. You end up disrupting the natural rhythm. If you feel the erection starts well but disappears as soon as you change position or when you put on a condom, it is very likely that your mind is sabotaging your body. However, not everything is mental, and there is a treacherous physical cause that deceives many men. Cause 2. Venous leak. Venous leak, or veno-occlusive dysfunction, is a purely mechanical problem where the veins cannot trap the blood inside the penis. Imagine filling a bathtub without completely plugging the drain. You can fill it if the faucet is strong, at the beginning of arousal, but as soon as the flow decreases a little or you get distracted, the water drains away quickly. Men with venous leak achieve the initial erection, but lose rigidity very fast, especially if they stop manual stimulation. This occurs due to a weakening of the elastic tissue of the penis or structural problems in the veins themselves, being very common with aging, but can affect young people too. The striking feature here is that, even with a lot of desire and high libido, the penis simply wilts without control, regardless of your emotional state. Identifying this is crucial, as oral medications often don't work well alone in this case. Now, let's learn to differentiate if your problem is the head or the valve. Quality technical information is rare on the internet, so if you value this kind of clarity, share this video with a friend and take the opportunity to subscribe now, guaranteeing direct access to the best urology tips. Differentiating the causes. To know if you suffer from anxiety, cause 1, or venous leak/physical problem, cause 2, there is a simple observation test: nocturnal and morning erections. If you wake up with a rigid penis, or if you can have a full and lasting erection during masturbation when you are alone and calm, your hydraulic system, veins and arteries, is preserved. This strongly points to a psychogenic or anxious cause during sex with a partner. On the other hand, if you notice that the erection is weak even during masturbation, if morning erections have disappeared or if they are soft, the warning light for a physical problem turns on. In this case, venous leak or arterial problems are the likely culprits, and relaxing the head will not solve the mechanical problem. Besides these two major causes, there is a modern habit that is training your brain to lose the erection in the real world. Cause 3, desensitization. Excessive consumption of pornography associated with a technical and fast masturbation creates what we call desensitization, or death grip syndrome. The brain gets used to a visual hyperstimulus, screens, constant novelty, extreme fetishes, and a very specific and strong touch of the hand, which the vagina or oral sex cannot replicate. During real sex, the normal stimulus seems insufficient for your high dopamine-addicted brain, and it understands that nothing exciting is happening, cutting the erection. This is a behavioral cause that generates loss of erection in the middle of the act because reality is slower and less intense than videos. The treatment involves a dopamine detox, removing pornography to resensitize the neural receptors to touch and to a real partner. If you need videos to get hard, or if you lose the erection when stimulation stops for a second, this may be your main cause. But attention! Systemic diseases also silently shut down the system. Cause 4, metabolic factors. Diseases like uncontrolled diabetes, hypertension, and high cholesterol damage the endothelium, the inner layer of blood vessels, impairing the production of nitric oxide, which is the gas that makes the penis fill up. In the case of diabetes, besides the vessel, it attacks the nerves neuropathy, causing the pleasure signal not to arrive correctly, facilitating the loss of rigidity in the middle of the act due to lack of sensory feedback. Often erectile dysfunction is the first symptom of a heart that is not doing well. Another metabolic villain is low testosterone or excess estrogen and prolactin. Without adequate hormonal support, penile tissue does not have the health to hold blood, and libido fluctuates, causing you to suddenly lose interest during intercourse. A hormonal and metabolic checkup is mandatory to rule out these ticking time bombs. Knowing the causes, what can we do today to solve it? I bring these practical solutions every week here, so to not miss the chance to improve your performance, leave your like and confirm your subscription to the channel right now. Immediate solutions and treatments. If the cause is mild venous leak or anxiety, the use of constrictor penile rings, cock rings, can help mechanically hold blood inside the penis, acting as a safe external tourniquet. PDE5 inhibitor medications, such as tadalafil and sildenafil, help keep the artery open longer, compensating for anxiety or mild leaks, giving the man more security to regain confidence. For more severe cases of venous leak where pills fail, there are intracavernosal injections, which apply the medication directly into the penis, guaranteeing an automatic erection regardless of mental stimulus or adrenaline. As a last resort, the penile implant is the definitive solution for irreversible mechanical problems. As for anxiety and pornography addiction, sex therapy and habit changes are the treatments that cure the root of the problem, restoring mental control. Losing an erection during sex is not a career-ending sentence, but rather a clear signal from your body that something, whether in the mind, the routine, or the veins, needs adjustment. Ignoring this signal and trying to force it the next time will only increase trauma and anxiety, creating a snowball effect that is hard to stop. The good news is that for each of these four causes, there is a specific and highly effective treatment. Do not let shame stop you from seeking medical help. Most of these cases are resolved with correct diagnosis and simple treatment. Take back command of your sex life by facing the problem head-on and with the right strategy. Tell me here in the comments, do you feel your difficulty is more mental, due to anxiety, or physical, where the erection disappears even when you are calm? I want to know your story, and don't forget to subscribe so we can continue this conversation in the next video.